A lot of people are afraid to get their genes tested. They feel like there's nothing they can do about it. My genes are my genes, and I don't want to know. It's true, there are genes that cannot be modified, but what can be changed about our genetics is the expression of the genes and the tendencies. When we do look at a gene report at the same time, we also have to remember this is just potentiality. It is about lifestyle. It's about how you're living, and it's important to know that you have this tendency, but at the same time know that most of these genes can be turned on and turned off by lifestyle.
You may be predisposed to have heart attack in the future. With proper lifestyle modifications, now you can prevent it to the point that you're actually less likely than somebody who doesn't have the gene. Having more information about our body to be able to know what can help us is very hopeful. Many people talk about genetic testing and the benefits of genetic testing, but there is still a lot of confusion for patients and for providers as well, how to actually implement genetic testing as part of clinical practice. How to make it easy. What should we be actually looking at and why? And that's what we're going to be talking about today. I believe it's very important because treatment plans should always be individualized. Recommendations should always be individualized because everybody is a little bit different. Everybody's situation is unique. And that's why I believe this interview will be very, very helpful for you listening, whether you're a patient, individual, or a provider. Today, talking about individualized, I'm here with a person who has a very individualized career path, very unique, because she's a pharmacist who is trained and certified in lifestyle medicine. She did a year-long mentorship with Dr. Dan Kalish, and she studies functional medicine with focus on how to use genetic testing to optimize for better health. She is the owner of Rimby Health. Stevie Snow, welcome to Polish Your Life.
So much, Mike. It's great to be here. I'm so excited to talk about this subject. It's near and dear to my heart, and you'll have to really rail me in to get me to stop talking at 30 minutes about this. It's important for us all to know how accessible it is, really, because I think I've blown minds for a few people when they realized, oh, this isn't something that's out of reach for the average person to be able to do.
Yeah, and that's super important. That's what I want people to understand is this is not something that is only reserved to people like Brian Johnson who have a pretty much unlimited budget. This is, very accessible, and it's a common practice right now in certain circles, and we just want to make it more accessible. And we also want to show people, a few tips and tricks that they can use to make it part of their practice or part of their healthcare journey to move the needle when the needle needs to be moved. So, to give people a little bit of context, I wanted to ask you because it's not a typical path for a pharmacist. So how did you get into functional medicine and then genetic testing as part of it?
Oh, yeah. Thanks a lot. So I've been a pharmacist for over 30 years, and I came to functional medicine the way most practitioners come to functional medicine through my own personal health journey. Suffering from PTSD, anxiety, insomnia, hypothyroidism, IBS, hit rock bottom at one point, lost all of my things, my worldly possessions, had to rebuild from scratch, start a whole new career, and went into hospital pharmacy after, 17 years of being a pharmacist, where previously I'd worked in nuclear, which was, just radioactive drugs, but not really in touch with what was going on in healthcare. And then as a hospital pharmacist, seeing on the front lines how we're really good in conventional medicine at saving lives in acute situations, broken arms, heart attack, stroke, those kinds of things. Conventional medicine can't be beat. But where it's failing is when we're addressing chronic illness, just long-term illness. It's a pill for an ill isn't helping anybody. And so through my own health journey and finding that medications weren't helping me, what helped me was going outside. Someone gave me a horse, actually, and that got me out of my depression. I had to care for this animal. I did some gardening, and my point of view turned around, and I was able to pull myself up out of the weeds. Now, I'm not saying that medication isn't important, and it helps some people. It just didn't help me in that situation. And then I've seen also from my sweetheart, he was basically being circling the drain. His doctor was watching him get sicker and sicker and sicker, and she just kept adding more and more medications for him, and not noticing that those medications were actually making him worse. And how genetic testing came into the picture, in particular with him, was that it turned out he has almost no ability to clear toxins out of his body. And so, what was causing his hypertension and his high cholesterol and failing renal function was actually heavy metal toxicity. Now, that's not something that you're just going to pull out of the box and say, oh, that's what you've got. I mean, we went through everything else before we figured out what that was. And when I then looked at his genes, I saw, okay, not only is he not clearing drugs, he has no ability to clear heavy metals. And then his practitioner actually did him a disservice and detoxed him too fast without preparing the
Mm,
body for the onslaught of metals to be released from his bones and his muscles. And he got sicker instead of better. And so what
wow.
I've learned from all of that is, that in functional medicine, integrative medicine, holistic medicine, these are really important aspects, and they do have to be done safely, intelligently, cautiously, and I think slowly is the key word here. Is it's just not a pill for an ill, and it's not a supplement for an ill. It's a process.
Yeah, I think this is one of the things that is very hard to sometimes to explain to people and sometimes to ask for, because as on the provider side, when you have somebody who is asking for help, they do want to have that solution that works tomorrow because there may be pain associated with this. There may be like a major problem that is preventing them from doing what they need to do tomorrow, next week, next month. And at the same time, what we are saying is like, okay, let's go with the right approach that is going to take some time. It's strategic, is the right way, but you may actually need to be patient with this. I think a lot of people are not ready for this, and that's where the paradigm shift is important, because it's not actually about, how what can I do to make me feel better tomorrow, but what can we do to make people feel better tomorrow if it's possible, if not next week, next month, but also long term. So this is something that is more sustainable. And then if it does come back, what can I do? What is the mechanism that got me out the first time so I can use the same mechanism? And I think that's where genetic testing can play an important role as well. And you mentioned this already. I wanted to touch on this aspect of integrative healthcare. The way that we see it in our doctors networking group, as you know, is the viewpoint and the way of practicing healthcare that combines conventional medicine with complementary medicine, with lifestyle medicine as part of this as well, and also what you do at home, diet, exercise, all of that included. That's all part of integrative healthcare, and that's done in a coordinated way. This is almost like this, dream that we want to come true for a lot of people. And I know it's not easy to do it, but I see that the circle of options is really not complete for most people. So how does genetic testing actually fit in that integrative healthcare circle? Where is the utility when it comes to that?
There are so many utilities that it's hard to kind of give a global view, but I can tell you just a few. Well, what really got me interested in it was when I was studying with Dan Kalish, and every once in a while in a lecture, he would say something like, well, depending on your genes, glutathione, for example, could make you feel better for a week and a half, 2 weeks, and then suddenly you're going to feel worse. And I'm like, wait, what? What gene is this? What I need to know this one is like, I don't want to be recommending or offering glutathione as a solution to somebody if it's going to make them worse. That's not what we're here for. And so I thought, oh, I need to know. I need to know what these genes are. And how I can tell you how it's helped one of my clients in particular. She's a pharmacist. She's given me permission to talk about her stuff. She's a client. She's a functional medicine pharmacist, and she was suffering from um, prediabetes, and she was wearing a CGM, a
Hmm.
continuous glucose monitor, so a patch on her arm that could tell that in the middle of the night her blood sugar was dropping into the 50s and was waking her up. And it's hard on the body to have low blood sugar. It probably could, you could say, even harder than having high blood sugar. The body says, it thinks it's dying, right? It's very hard to go back to sleep after a low blood sugar event in the middle of the night. And so she asked me, Stevie, what do I need to do? What carbs should I eat before I go to bed so that I'm not having this drop in the middle of the night? Because she was practicing fasting. In particular, she was doing Walter Longo's program of fasting mimicking, where she still ate 400 calories a day, but was basically not giving her body any sugar. And I'm like, no sugar before bedtime. not not for most people, and certainly not for you if you want to achieve your health goals and reverse that prediabetes. And so I took a deep dive into the labs that we had done for her. We did an organic acid test, a functional medicine test that looks at the metabolites of different reactions in the body and can kind of backwards point. It's nothing very specific. You know, you don't have elevated like calcium. It's not measuring calcium. But if certain markers, three or four of them are high in the same way, then you know due to that metabolic pathway that makes those that there's something missing or there's too much of something in that pathway. And so what she wasn't doing, obviously, Veronica wasn't converting fat into sugar. She was not metabolizing fatty acids. If she didn't have sugar in her body and her glycogen stores in her liver were depleted, she was going into hypoglycemia. And so just thinking about this, and carnitine is important for fatty acid metabolism. And so I looked on her organic acid test, and yeah, there were a couple of signs that she might have low carnitine. And then I looked at her genes. I did some research and I found out which genes are important for carnitine metabolism. And it wasn't obvious. It wasn't something that I could just like punch into my databases that I use. But sure enough, on this one gene that I had two or three SNPs, and the SNP is a single nucleotide polymorphism. It's just a variation in a gene. And I had a couple. Other people who didn't have problems with blood sugar had three, four, five, six. She had 2 pages. She had 40 SNP on this
Wow.
one gene. And so for 50 cents a day, she takes carnitine at night, and within 2 days, sleeping through the
Mm.
night, within 4 months, had resolved her prediabetes. And it was due
Wow.
to a genetic situation that was unique to her. And so it's not something that you're going to find super easy if you were just doing your own genes. But the answers to many of these difficult questions that we are facing with our clients can be found by just looking at the genes.
That is seriously amazing because imagine the alternative, still struggling with this and then trying to maybe do the opposite that your body actually needs because logically it looks like I need some carbs because I need more sugar in my blood. Well, actually, it was a very different solution and a simple one and an inexpensive one, like you mentioned. So for everybody listening or watching, I want all of you to pay attention to the fact that it's not genetic testing alone or organic acids alone. It's the combination of both of these, probably with, the evaluation and what you knew about the patient, lifestyle. All of that combined gives you a more complete picture. And genetic testing can be that mystery box that actually is able to move the needle the right direction when that needle needs to be moved that right direction and the patient is waiting for it. So quite amazing. And thank you for bringing that as an example because I'm sure there are other examples similar to this, but about something different that you can give us. So I'm thinking if a healthcare provider thinks about incorporating something like this, what are some of the common findings that genetic testing is allowing the healthcare provider to use for their care? So let's say somebody already has functional medicine protocols. Maybe somebody has a different type of practice, and what would the genetic testing be helpful for?
Okay, and there are a lot of options out there for people, so I want to help avoid some pitfalls or maybe just make sure that you understand what you're getting when you're paying money for these different tests so that you're not disappointed or that you also then get your money's worth. But let's back up one step backwards and say, a lot of people are afraid to get their genes tested. They feel like there's nothing they can do about it. My genes are my genes, and I don't want to know. Heart attacks run in my family. I don't want to know. And it's true, there are genes that cannot be modified, but what can be changed about our genetics is the expression of the genes and the tendencies. So, um, when we do look at a gene report at the same time, we also have to remember this is just potentiality. There was just no
Mm.
hard, fast thing like, oh, I have the heart attack gene, because it does exist. There's a heart attack gene. I have that, and therefore I'm going to have a heart attack. Like, no, that's not the book of life for you. It is about lifestyle. It's about how you're living, and it's important to know that you have this tendency, and you probably have guessed many of the things in your genes. It'll be fun to get a little bit of confirmation of the things that you suspect about your life and about yourself when you get your gene report. But at the same time, know that most of these genes expressed can be turned on and turned off by lifestyle. Lots of studies done on this. Eating broccoli, cruciferous vegetables can turn off, I don't want to say hundreds of genes that can cause prostate cancer, and turn on another couple hundred genes that prevent or suppress cancer gene or cancer growth.
Wow.
So yeah, genetic testing is helpful. Don't be afraid of it, but and know that it isn't a sentence, right? It's
Of course.
just
And
possibilities.
I think a lot of people talk about genetic testing combined with lifestyle modifications because of that kind of like a filter. The way that I imagine it is like a filter, right? So we have our genes, and then we have the filter here, which is our lifestyle. So the genes pass through, but some of them don't express themselves if the lifestyle is, supporting the healing process, right? And it's very good for health. On the contrary, if there is environment, that's how I'm understanding it, and you can let me know if this is the right way to do it. On the contrary, if the lifestyle is actually really, let's call it bad, right, for your health, then certain genes express themselves, and then we are more likely to get sick. Am I understanding it the right way?
Yes, that is exactly a great way to say it. That your lifestyle, your genes are not your destiny. Your lifestyle is your destiny, and so you can turn good genes on, bad genes off through making right choices. And then if someone is genetically predisposed to be not a very good detoxer and decides to be smoking and drinking alcohol in excess and not sleeping well and eating a crappy diet, then yeah, the odds are that they're going to have a pretty predictable future requiring lots and lots of conventional medicine care for chronic disease. But take that same person and have them know what nutrients they tend to be low on due to their genetic makeup, and have them go to bed on time, eat a healthy diet, have good relationships, deal with stress properly, and those kinds of things. Now you can just turn the dial. It's almost like a course correction, especially if you do it earlier. But it's never too late to make a course correction and just completely miss all those chronic diseases, and instead go on to live to be 80, 90, 100 years of age, like they do in the blue zones where people are living to be 90 and 100 years of age with almost no chronic disease. It isn't that they won the genetic lottery. These people have just as crappy genes as the rest of us. It's about their lifestyle and how hard their lives are, actually, how much work they have to put into exercise, to cleaning their house. They don't go to the gym. They chase sheep up and down hills. Now, we don't want to have to do that in order to live to be 90 years of age. So we just have to find out where in our life is our comfort level too comfortable, and kind of get ourselves out of that comfort level, do hard things, expose ourselves to heat and cold. And I'm sorry, I'm getting off topic here, but just the things that you can do in order to minimize what effect any genes you have that might set you up for chronic disease can be mitigated.
It's actually very, very optimistic because if somebody is, looking at their genes and they see something that could be a risk, just knowing that there is a way out or a possible way out, like you mentioned, all of it is probabilities, right? So yes, you may be predisposed to have heart attack in the future. Okay. Well, with proper lifestyle modifications, now you can prevent it to the point that you're actually less likely than somebody who doesn't have the gene. So I see it as a very optimistic and empowering type of situation because having more information about our body to be able to know what can help us is is very hopeful because a lot of people struggle. And the one example that I always keep coming back to is this example that we see many of, which is somebody who is going from doctor to doctor, follows recommendations, and still doesn't get better. And then what? And sometimes all it takes is that additional piece of information that was missing. And then the course correction happens and that person gets better. I think there's no price that can be put, in a situation like this because sometimes a diagnosis like this and a problem like this is a problem for the whole family. In our personal life, we understand what people are going through to a certain extent because we had some, ups and downs. The road was not really super smooth all the time. And if we can bring resources to people, of course we will. So for healthcare providers listening, if they think about situations in which they can use genetic testing, give us some practical examples for healthcare providers, um, how genetic testing can be incorporated as part of the practice.
Okay. And what I like to do generally is about a $300 test, and it's through Functional Genomics Analysis is the company I'm currently loving. And, it's 2024, so I don't know if the prices are going to go up. I don't know when people are going to be watching this video. But for right now, it's about $320, and it is full genome sequencing. And it's only available to practitioners, so it's not like the layperson can go and purchase this particular test because it's not very easy to interpret. They do have their program for interpreting the pyramid as it's created by Bob Miller, the founder of functional genomic analysis. But I prefer his test, say, over a direct-to-consumer test, which is 23andMe, uh, Ancestry.com, or MyHeritage DNA. Now, we can use those, but they have limited utility when you're going deep into things. For example, this gene for the carnitine. I'm not sure I could have found that had that client used a 23andMe test. But 23andMe is still pretty good. Now they have very much focused what genes that they're looking at through 23andMe and MyHeritage and Ancestry DNA on traits, colors of eyes, the consistency of the wax in your ears, stuff that's really not very helpful when you're asking about functionality of the human body. So that's why I like functional genomic analysis tests, but you can still use 23andMe. If you've already got it, right now I think it's $100 usually on sale. Father's Day is coming up. It's probably going to be $100. And right now they're my favorite for direct to consumer over Ancestry and over MyHeritage. MyHeritage is like a $39 test, and you kind of get a $39 result with that one. The report isn't as useful in the other platforms that I like to upload this raw data into in order to look at stuff. But 23andMe, you're going to get a pretty good feel for some of the things that are important. And how can you utilize that data instead of just getting the report that they offer you? What you want to do is go back on, log in after your results are available, and get your raw data. In fact, because 23andMe did have a breach a few years ago, that I recommend you get your raw data off of there and then delete your account.
Mm.
Get the account, get it saved onto your computer, someplace safe, and then just delete it so that if they ever had another breach, then nobody has access to your genetic DNA material. But this raw data then can be uploaded into different programs. And the one I'm loving right now is called geneticlifehacks.com. Debbie Moon is a gal who has just developed this amazing platform with over 300 articles on different genes or groups of genes that tend to cluster together and to cause certain disease states. And so you upload your raw data into here, and I think you could purchase a subscription for her for maybe $45, $50 for a year. You upload your genes into this thing, and then when you open up each article, scroll to the bottom, your genes are put into the article. So if it's about the MTHFR gene, the mother effer gene that has to do with folate metabolism and methylation, you not only will see this beautiful article about what is MTHFR and why is methylation so important for health, but what are your genes, and then scroll down a little bit further and get to the life hacks, and these are the things you can do about it. So I think for direct to consumer, this is a great combination. Get the 23andMe, get your raw data, purchase a subscription to geneticlifehacks.com, upload your data into that, and know when you do, that data is still staying on your computer. You're not just uploading it yet into another unsafe uh, ozone or thing like that. It stays on your computer, and so still your data is safe with that.
Okay, so I want people to understand there is a difference between getting the report from these companies and also getting the raw data that you can download and then you can upload it to different there are different options for where you can upload it to get interpretation of that raw data that is much more towards the functional approach versus like 23andMe is focusing on just some other aspects. Also, what you mentioned is this is something that is not necessarily requiring a patient or a person to go to see a provider because they could, get that genetic testing done independently of having a healthcare provider. Even the interpretation they could get independently as well. So, what would be the reason for somebody? Because what about people like you? Why are you needed in the picture?
Oh, well, there's other things that we can find out with the genetics and go a much deeper dive. And what I like to do too, then, is, of course, take into account the personal health history, what's happened to this patient or this person, not only what diseases have they had, but what have they lived through? What traumas have they lived through? Because that's often the root cause of, when were you last well and what happened right before that? Oh, there was a death in the family or a divorce. And then that is what set the stressor of that set off this chain reaction of illness. But then you take that into account. Then you take into account lab results. So if someone has the heart attack gene, I'm not really looking at cholesterol when I look at their labs. I'm looking for prediabetes or pre-diabetes. I'm looking for markers that show that this person is becoming insulin resistant. Because if you have the heart attack gene and you're a diabetic, a very good chance you're going to have a heart attack. But you can have that gene, and if you avoid prediabetes and diabetes altogether, then your risk of heart attack is just like someone who doesn't have that gene. And so, what I can do is, bring that all in together, and then make, recommendations on what kinds of supplements to use, because I think that we've talked about this a couple of times already, and that people think that glutathione is just this wonderful antioxidant, and it is. It's very powerful, but it's better to make it than take it. So I would much rather see, rather than someone taking glutathione, not only is it inexpensive and it doesn't necessarily survive the digestive tract and get absorbed into the body, but some people who take it and who have a certain gene, it's called a GSR gene, who cannot recirculate oxidized glutathione back into the form that makes it want to, do the wonderful things that it does in the body as an antioxidant. When it gets oxidized, if you aren't able to recycle it and you take more glutathione, you could get sicker instead of better.
Wow. So what about people who take, IV drips, IV vitamins? Because part of these cocktails usually is going to include glutathione for health as well.
I would say pay attention to your body. If you don't have your genetic data, just walk in there and say, how do I feel? Get the injection and say, how do I feel? Some people feel like $1,000,000. They're like a
Mhm.
different person. They get that glutathione and they think this is the most amazing thing, which is why glutathione has such a great reputation. Other people don't feel any different. And then other people will feel terrible. Okay, and so that means that they have oxidized all of their glutathione, and now it is going around and causing even more damage than had they not done it in the first place. Okay.
So I want people to understand on a surface level, especially if there is no major problem, this is something that they can incorporate themselves, get the testing done relatively low cost. There are different platforms, and I'm sure that you can find, do your own research. The platforms we are mentioning here are just examples, and that can be done. I think what's really important for both patients and providers is when there is urgency and seriousness of the situation. So somebody is dealing with a chronic disease and doesn't really have that room and comfort that allows them to make mistakes. because something can go worse. Something can be preventing them from getting better. I think that's when it's really important to have somebody who has pattern recognition, who has the knowledge, who has the experience to be able to recommend certain things, to be able to guide towards one direction and then evaluate if that was the right choice. And I want people to understand that you do have a lot of options to even start yourself. And if there is additional information that is needed, if there are some questions, then scheduling a consult with somebody like yourself can be extremely important because it could be uh, helping you hit that bullseye instead of getting lost in the complexity of this. Because I've seen these reports, and I know you talk about them like they are, great recommendations, and I'm sure they are. But the problem that I see with a lot of them, they're extremely complex, and I don't really have time to dig so deep and to read 92 pages and to try to figure out, what should I do, even though it's pretty self-explanatory in some cases. When you look at graphs and you actually dig a little bit deeper, it becomes confusing and sometimes demotivating. So for me, it's actually pretty awesome to know that I have support, and I want people to feel like they don't have to figure out everything themselves. And if they get confused, there is an option to ask for help. For healthcare providers, I would like to give a few examples of what you have been able to find as pretty common findings, surprising findings that also are examples of common patterns. Like glutathione is one of them. I think that's really important. I would like you to talk about some other common findings that you see that were very helpful clinically.
So one good example of a gene to look at and start with is just the MTHFR gene, the mother effer gene. A lot of people are pretty familiar with that. Now, everybody has the gene, but not everybody has an allele on this gene. And so if you have an allele, a SNP on your MTHFR gene, makes you what we call a poor methylator. And a poor methylator is someone who then doesn't have the good ability to make active forms of certain molecules or to detoxify certain toxins. Like methylation is important in so many things in the human body, but it's basically how our DNA, our epigenetics, our turned on genes communicate with the body to give it what it needs and take away what it doesn't need. So methylation is involved in so many things inside the human body. And a reason why it's so important is that we can't form a fetus. A woman cannot make a healthy fetus without a lot of activated folate, so methylfolate. And so the federal government decided in its infinite wisdom that it would put folic acid into all processed foods, thinking that would prevent birth defects. Well, it was only a small percentage of women who were having this one issue. And so to give that to everybody has done more harm than good because some people can't metabolize folic acid into methylfolate and they get this buildup of folic acid. And in some people with certain genes, that's a toxin in the body. So the methyl MTHFR gene, people think, oh, I've got this allele, I'll just take methylfolate. And that seems like a good idea, but that's where the nuances of, really studying this come a little bit handy here in that some people who also have issues with COMT can get over methylated. So yeah, methylation is a good thing, but you can overdo it. And particularly if you have a certain COMT combination, there's a fast and a slow COMT. And depending on which one you have, you can get over methylated. And just like with the glutathione, something that seems like a good idea can actually cause some harm.
It seems like finding harmony and balance is always important. So here, I'm curious about some stories that you can say, like you mentioned with that one person, um, some examples that providers can relate to. What are some of the conditions or problems that people are dealing with that usually that genetic testing can be helpful for?
I can tell you from my own personal experience, I'm going through right now a mold toxicity. I
Mm,
lived in a cute little place in Tampa, Florida for 4 months and turned out it had mold. And
mm,
I know this because now suddenly I'm pre-diabetic. I've never had issues with blood sugar control in the past. But guess what? If you look at my genetic predisposition for diabetes, it's crazy. It's like, oh, I remember looking at that when I was really feeling good. I'm like, that's crazy. I'm not a diabetic and I have all these markers for it. Well, so if something goes wrong in my body, I'm going to become a diabetic. And that's what this mycotoxins have done to me. And it's also caused swollen joints. They're not painful, but they're very swollen. And I have genes that keep me from clearing oxalates. And
mm.
mycotoxins increase oxalates in the body. And so by knowing my genetic makeup and knowing that I have problems with histamine, oxalates, and prediabetes, now I can really focus how I'm going to treat myself. I'm going to avoid foods that are high in oxalate, and I'm going to avoid foods high in histamine, and I'm going to, go to the sauna and make sure that I'm detoxing properly and support all my pathways. And I know I can take glutathione, so I don't have to worry about taking just the precursors of those things, which are, by the way, are cysteine and glycine. So that's one example of just how to get through a difficult situation and do it in the fastest way possible is by knowing at the genetic level what I'm good at and what I'm not good at.
This is interesting because as we are talking about functional medicine approach being that, strategic approach that is more like playing chess that, needs to put all these things, in the right order at the right time as well. And, with the right volume and intensity, like you mentioned, it shouldn't be too much, it shouldn't be too fast and all that stuff. Actually, incorporating genetic testing could be the catalyst, can speed up the process of healing because now you know how your body is going to likely react to certain type of nutrients, how to modify your diet, your lifestyle, and that is very, very powerful. For me, it was a really interesting discovery that my body doesn't really methylate B12 properly. So even though my lab work may show me that I'm B12 deficient, if I take the wrong form of B12, I may actually increase toxicity and do harm versus good. But my lab work tells me I need B12. So how important is it to know what form, right? Or is it more safe for people to always go with methylated B12, like methylcobalamin?
No, it's not safe for someone to always go with methylated B12. Sometimes you want to go with adenosylcobalamin or hydroxycobalamin, and that's people with that COMT gene. Remember what I talked
Mm,
about with the combo
yep,
of being a poor methylator and having a certain COMT gene, then that's a person who can get over methylated, and then they're going to become very anxious, and they're going to have like panic attacks. And now you go to the doctor with all that, and you're going to get another medication instead of saying, "Oh, it's a supplement I started."
right.
That's, making me feel worse.
Well, you remind me of another topic that is another rabbit hole that we don't have to get into too much, but I want people to understand that genetic testing and the analysis can also help determine which medications are going to be better for like pharmacogenomics, right? We were talking about which medications are going to be more successful, which medications can be actually harmful, and which medications not to combine with other substances in the body based on a genetic makeup of the person. It's quite amazing and very important to know.
It is. And pharmacogenomics is separate from, say, what we're talking about here. Pharmacogenomics has to be ordered by a medical provider, and it is a really, really good idea. If you know anybody, listeners, who's going through chemotherapy right now, they need to get this done because many of those products for chemo and cancer treatment depend upon a certain pathway in your body. And researchers know this. And so you just have to make sure that if you're getting treated with chemotherapy, that you've had your genome looked at and make sure that the drug they're giving you is one that's actually going to work for you. Because how will you know it doesn't work? 3 months later, you're still sick, and now you've spent that money and you're even sicker than you were before. So it's super important. Now, there are some things we can find out through 23andMe or through functional genomic analysis about drugs. For example, are statins likely to work for you? Are you likely to get muscle pain with a statin? Will Plavix work for you? Those are ones that we can find out. And Plavix is an antiplatelet drug that people are put on after they've had a heart attack or a stroke. And willy-nilly, we put people on them in the hospital, even though a good portion of them cannot metabolize that drug into the active form. It does them there's no good whatsoever to put it on
Wow.
Plavix if they cannot convert it into the active form because it is a pro drug. And genetically, some people just cannot do it, and we are doing them a disservice. So it's great for you to know in advance if that's a gene that you have, so that if God forbid that ever happens, you could be put on a different antiplatelet medication.
It would be so cool to be able to somehow influence, the gods above to incorporate it as part of the standard of care, because that will actually save people, not
Many
only.
hospitals do. Some hospitals
Oh, they
including that
do.
into,
Okay,
yeah,
super.
that genetic testing is something a physician can order inside their HMO or the EMR program, but it's not standard of care.
Mhm. I'm thinking also about our biohacking community, right? We have a lot of biohackers who are, you know, connected to us. They are, talking about different supplements. They're talking about different things that are good for you or bad for you. And what is fascinating and interesting is that the supplement or the supplement cocktail that is, recommended by somebody with great intentions may be really good for them, but not good for you based on your genetic testing, right?
Exactly right, because there's no such thing as the standard American person. Just like same thing with drug testing. All those clinical trials are based on the average guy. Well, guess what? That average guy doesn't even exist. What about, the 75-year-old woman who needs to take that drug? Does that drug work for her? They don't know. They never even tested it in that population. Same thing are true with supplements. We're all highly individualized, and that's why I like it isn't just chess. Bob Miller, founder of functional genomics analysis, calls it underwater 3D chess.
Wow, that's deep. So explain that to me, what he means by that.
Well, we're going to take, the health history. We're going to take the genetic profile. We're going to take an organic acid test result, a functional medicine test that looks at metabolites in the body, and look at the advanced blood work and symptoms. And with all of that, come out with a concise uh, recommendations based on all that information so to speed the healing process.
I love that. Well, what is it if not integration, right?
That is
That
integration.
is awesome. This all sounds truly amazing, and I'm so hopeful, so grateful that we have all these tools that are out there, and they're becoming more and more accessible. You already mentioned what patients or individuals can do, even independently of their healthcare providers, to get the test, and also where to go to get the report as well, and how to get support if they need. Of course, they can connect with you or a provider who is specializing in this, and we're going to include your information in the show notes as well. I would like you to also mention a little bit about the steps that a provider can take if they would like to incorporate this as part of their own clinical protocols or collaborate with you. What would you say the easiest steps for them would be?
To collaborate with me, you could just reach me at stevie@rimbyhealth.com. That's my email address. And RIMBY stands for right in my backyard. That's where I believe health begins, outside in the sunshine, literally soaking up the vitamin D and the infrared rays from the sun. But also, philosophically, within inside of our hearts, our bodies, is the ability to heal, and we just have to release that. So Stevie@rimbyhealth.com is how you can reach me directly for practitioners who want to incorporate some of this into their program. They could also, practitioners could go ahead and get an account with YFG or functional genomic analysis and order these kits and take a certification program through Bob Miller or pay Bob Miller personally to review those reports with them. That's another way to do that. Then for consumers, we did talk about the geneticlifehacks.com. Whatever route you go, make sure you can get your own raw data.
Big thank you, because this is something that can move the needle for a lot of patients and also for practitioners. I know it's important because we talk to a lot of providers who care so much about their patients that that's to the point where, the office doors are closed. They're going home and they're thinking about that patient. And it's not just another case that walked in. This is Mike or Stevie or whoever else. This is that person that they're really thinking about, what can I do to help that person? And adding genetic analysis, adding somebody who's going to be able to team up with them, I think can be very meaningful. And I'm just so grateful, so happy, so optimistic. Well, a lot of people complain. I like to be optimistic, and I see that this is extremely powerful. Big thank you for joining our Doctors Networking group. We are going to be connecting you with a lot of providers, as you have already experienced. And thank you so much for being so responsive. And I'm getting great feedback from providers I connected you with. How can we as a group support you, Stevie?
Well, thank you very much. The reaching out to me directly if you have any questions, I'm happy to answer any questions and direct you to any way that I can help you. If it's working as a collaboration or taking on clients directly, if you need help with a complicated patient. But at the same time, I want you to know too that this is helpful for gym owners too, whose client base they just want to go from good to excellent. That I've helped lots of people who came to me just to lose weight, and turns out, they had the heart attack gene, they're pre-diabetic, their cholesterol is out of whack. Like these are things that you would not have found out until you were, 10 years down the road, and then your options are just to be put on medication. So it isn't just for the practitioner who has the very patient that's very difficult, although that's a great way to utilize this technology. It's also great for the 25-year-old female who just a little bloated every once in a while. And, just the information you can find from a genetic report and lab work is life altering.
Awesome. So for everybody listening or watching us, connect with Stevie Snow. We're going to put the information down below. And once again, her website is Rimby Health. And Rimby is right in my backyard, health.com. Awesome. Big thank you. Till next time.
Thank you, Mike.